Alright, Mom, what do you know about gingivitis?
Gingivitis. I know that they have commercials about gingivitis.
True, true. Anything else?
That's it. It's some type of a disease of the mouth. Causes your gums to recede.
Hmm. Well, interestingly enough, it actually causes your gums to be more inflamed and swell. So, normal healthy gingiva is generally pink and a lot, like pretty much a regular surface layer of the teeth, whereas unhealthy gingiva, such as like when you have gingivitis, the swelling actually increases and a lot more gum tissue is going to appear over the teeth. And the reason that this can be an issue is because during that inflammation, bacteria is actually going sub under the teeth, or under your gums rather. And that's where the real bad stuff starts to begin to happen. And basically what that is that's a pocket, because when you try to, or say for a dental hygienist where they try to like probe there, and they see all that inflamed tissue, that can, if left untreated, could form a pocket, which is basically when the tissue underneath that inflammation starts to get dissolved and deteriorated by the bacteria. And that can result in bone loss that's irreparable. So, we talked about bone loss.
So what happens if you lose your bones?
You can't get it back. The only thing that you can do at that point is just try to save whatever bone you have left. But if it comes to the point where you do need fake teeth, then it is what it is at that point.
Yeah, okay.
So the reason why the gums bleed, something that I forgot to mention, is because they have stuff in them, or they have like a invasive bacteria in them that shouldn't be there. And they bleed because they're highly irritated. So whenever you brush your teeth and you have your gums bleed, is because you're coming into contact with all the bacteria that's been building up underneath the gums or inside the gums.
Why can't it just be that you cut your gums?
Well, it's generally not that easy to just do that, but you can technically do that if you brush vigorously.
Okay.
One of the things that can be a thing is the vigorous brushing can lead to like the show of like your tooth root, and that can cause some problems within itself. But generally speaking, the gums, although very sensitive by themselves, do not act in such a way immediately. And also, usually when it bleeds from gingivitis, it's not really painful either.
Okay.
And that's purely because of the, invasive bacteria.
Okay.
So factors for disease progression, improper oral care is the primary one. It can kind of fester for 1 to 2 days, you don't really see anything. But come around 4 to 7 days, that's when you start to get inflammation and things start to take a turn for the worse. And then 14 days plus, that's when you might receive the more severe symptoms. And that can go along with what is periodontitis, which is the actual bone loss. And that is irreparable. Gingivitis is curable, and it's actually reversible. But
that's why it's important to get cleanings, right?
Exactly. Well, just proper oral care in general, because proper oral care by itself can reverse the effects of gingivitis. But if left untreated, by either a health clinician or a dental hygienist or you, then that can lead to periodontitis, and that's when we get into the realm of bone loss. And the reason that that's huge is because the bone loss that's happening isn't exactly visible to you, but it's actually happening underneath the gums. So when I mentioned a pocket earlier, there's this thing called the junctional epithelium, which is where your visible tooth connects with the gum line. It is the generally healthy, generally you'll find that the junctional epithelium is, if your gums are touching at that point, that's healthy gums. But with gingivitis and eventually periodontitis, gingivitis will make the gums look way larger than they normally are. And then with periodontitis, it will actually start to eat at the bone underneath. So you actually have a much less sturdy foundation of your teeth.
Okay.
Some people can even be found, like you can even find someone where you just shake their teeth a little bit and it'll wiggle with you.
Okay.
And, that requires, possibly extraction, because like now what are you gonna do with that teeth? You can't get any of it back. You might need to use some fillings, but even with like fillings though, that could cause some problems because the fillings, whenever you floss, you have a chance of getting caught, the floss getting caught with the filling, and that can create some problems too because bacteria can actually grow within those gaps. So, some risk factors to kind of point out: genetic disorders, genetic markers, age is kind of a big one for mostly everything, and also race. These are things that you can't modify and should be taken into consideration when you are undergoing personal oral care or professional, because these things aren't really things that you can change. So, and yeah, that's it. Any questions? Awesome.